Good afternoon, viewers. Once again, from Sunetra Family Eye Care Center, Kolkata, with our patient education series, episode number 40. And we have with us an eminent speaker from Brisbane, Australia. Give me a moment. I shall be happy to share more information about the speaker. Okay. Yeah, so as I said, this is Patient Education Series, episode number 40. And our speaker for the day is Professor Bala Venkatesh, who I very proudly would like to proclaim that I was fortunate enough to be his batchmate in college during MBBS. And Professor Bala Venkatesh was the best outgoing student in our batch. He was the most hardworking and studious guy in the class. And he has a whole lot of educational qualifications after his name. He is specialized in intensive care, and he is the director of intensive care at Wesley Hospital in Brisbane, and preeminent specialist at Princess Alexandra Hospital in Brisbane. He is a professor of intensive care in University of Queensland. He is an honorary professor at the University of New South Wales in Australia. He is a professorial fellow at the George Institute for Global Health. He is the chair of Queensland Statewide Sepsis Steering Committee. He is an adjunct professor of St. John's Medical College Research Institute in Bengaluru, India. And he was the past president of College of Intensive Care Medicine in ANZ, Australia and New Zealand. And Professor Bala Venkatesh has been working in the COVID ICU at the hospitals mentioned. And he has a vast experience in the subject of managing COVID-19 infection. And he is going to talk to us today. Over to you, Dr. Bala. Welcome, and very happy to have you on the show.
Biswas, once again, it's a great honor to be there on your show. And thank you for this privilege, and very humbled by the wonderful work that you do, and for the public good and for the patient welfare. So look, thank you for the opportunity to speak to all our friends and colleagues in India. And
Yes.
before I start, I would like to acknowledge the huge amount of the stress that people in India have had to go through the COVID second wave. And I want to say that the people of Australia are in solidarity with the people of India and wish you all well. And we also acknowledge the huge amount of work done by the healthcare workers in India, both the medical, nursing, and the allied health staff. And we salute them for their fantastic work. So, so with that, I will just move to my slides. So just give me 5 seconds. I'll just share my screen. Can you see my slides?
No, not yet.
Oh, just 1 second.
Yeah, take your time. Take your time.
Yep. I think.
Yeah, COVID-19 infection has been. Yes.
You see it now?
Yes, the slides are on.
Okay. So the title of the talk is 10 False Beliefs About COVID. And the reason I chose this title is because India is going through a second wave, which is massive. It's affected several people. We all know a family member or a friend who has been affected. And understandably, there's been a lot of anxiety and concern amongst the public. And we have seen reports of shortage of oxygen and essential medications like dexamethasone, and so on. And because of the nature of the pandemic, there's a lot of uncertainty in people's minds about what to do if you test positive for COVID. And but if you only got mild symptoms, if you're not too unwell, and if you do not require to be hospitalized, what should one be doing? And there's a lot of misinformation on the internet and social media, and so I thought I would use this opportunity to try and go through some of these questions, and I deliberately made the title provocative, calling it 10 false beliefs, and I'm very happy to take questions at the end. So now these are my conflicts of interest. I am currently on the management committee of 4 clinical trials on COVID-19 in India, but I have no other conflicts of interest to declare. So the first, I want to start with the slide. If you type in COVID-19 and misinformation on the internet, just in this year alone, and this is on PubMed, which is the most reliable medical database, and just in this year alone, from the 1st of January to the 26th of May, there are 335 publications highlighting this problem. And you can see titles like the Misinfodemic, and in the Lancet, a publication called The Deadly Threat of Misinformation. So this is a real problem, and so we really need to be aware of what is the best way forward. So let's start with the false belief number 1, because there is still a misconception that COVID is not real, that it's a conspiracy, that it's a hoax, it's man-made, it's something to do with the 5G network, it's a political maneuver by governments to take control of its citizens, and it's got nothing to do with the virus. And a lot of these views have been coming through social media. There's information overload for people. There are multiple websites with data, and also have people's personal beliefs, and all these can now be easily disseminated on WhatsApp and Facebook and so on. So what is the story with this? Now, there is clear evidence that the causative agent is a virus. The cause of COVID is a virus called SARS-CoV-2, Severe Acute Respiratory Syndrome, Coronavirus 2. And how do we know that? Well, scientists from multiple countries have now been able to isolate the virus. They've analyzed the genome, what's called the genetic material of the virus, the RNA, which contains the instructional manual for the whole virus. They have actually analyzed it. We know it's a real illness. It's caused close to 3.5 million deaths worldwide. And in India alone, there have been more than 300,000 deaths due to COVID. Interestingly, the technology is now such that it can actually pinpoint which person you picked up the virus from. Because what happens when the virus goes from one person to the next, there are small changes in the viral genome related to the person it's coming from. So you can actually pinpoint. And it's because of this clear understanding of the science and the biology of the virus that we've now developed a very rapid vaccination program. And we've now been able to develop clinical interventions in various trials, which now have been shown to be useful. So I think the first misconception that COVID is not real, I think that's something we need to get our head around and say, look, in fact, this is a virus, and we've really got to deal with it the way any virus should be. Now that takes me to the second one, a closely related message, a false belief that COVID is coming under control. Now here is a graph which shows the cumulative number of COVID cases since the pandemic began. So on the x-axis, you've got the dates starting in January 2020, and on the y-axis, you've got the total number of COVID cases. Now, in the 12 months of 2020, from 22nd of January to the 31st of December, there were 83.5 million cases of COVID. In the first 5 months of this year alone, from the 1st of January to the 23rd of May, we've had another 83 million cases. So we need to understand that we've had more cases of COVID-19 in the first 5 months of 2021 than in all of 2020. And this is important because we have to be on our guard. We can't let go of all the important protective measures like masks and social distancing, because that's the only way we can get this disease and the virus under control. So that then takes me to the third false belief, where people believe that use of masks and social distancing are not necessary. Now, the reason we use a mask is it minimizes aerosol and droplet spread when you wear it, especially during coughing. And the social distancing is important because it minimizes contact between people and it keeps them at a safe distance from each other, and particularly to prevent aerosol exposure. Now, yes, wearing a mask is cumbersome. Being socially isolated is very isolating. And importantly, you can do it for short periods. It's difficult to sustain. But there is no question, there is absolutely no question that these two measures are very important, and we need to keep them up as long as possible till the virus is under control. And let me show you the evidence that these things work. Now, this is the case loads for India, again, starting in February 2020, all the way up to the 23rd or 24th of May. Now, this here is the first wave. This is the second wave. And what happened sometime in February this year is when we started to relax the restrictions, when obviously everything, all the transport system, everything got back as normal, and public gatherings started to happen. And obviously it's also the festival season, so people were mingling with each other. And as you can see, over the next 6 to 8 weeks, the caseloads went up rapidly and reached as high as 4 lakhs on average per day for about 4 or 5 days. And then restrictions were, individual states installed lockdowns, and therefore, which means it's like social distancing, and they also imposed measures like compulsory mask wearing, and the effect of that is very clear. As soon as you do that, the cases come down. Let's take another country, the United States. Now, President Trump was not a strong believer in social distancing or mask wearing. And so you can see there, that's the small first wave, an intermediate second wave, and a big third wave. Now, President Biden was inaugurated on the 18th of January, and that's somewhere there. And one of his first legislations was to make the masks compulsory. As soon as he did that, and obviously coupled with a number of other measures at the same time, and you can see the impact where the cases start to come down. Now, the other collateral benefit is other respiratory infections also start to come down when you wear masks and social distancing. Now, this is Australia, where I live, and we, as part of surveillance, we collect the number of all respiratory infections every week, particularly influenza. Now, let me show you the numbers here. On the y-axis, you've got what's called the surveillance week by week. On the x-axis and on the y-axis, you've got the number of cases positive for influenza. So this curve here, the dotted curve, is 2018, those number of cases. And this curve here, the intermediate curve is 2017, 2018, and then 2019, where we had about 20 to 25% of the swabs being testing positive. Now come 2020, where that's right at the bottom there, when we had significant social distancing and mask wearing, we had almost no cases of influenza. And certainly in my own practice in the intensive care unit, we had no influenza-related respiratory failure in the intensive care unit. So that shows the impact that on respiratory infections and the benefits of mask wearing, and social distancing. So now, what happens when we get COVID? And this, I'll go through the next steps. So this is a belief, false belief 4, because there's a strong belief amongst a large section of the community that as soon as you're diagnosed with COVID, you need to have supplemental oxygen immediately. The thing to keep in mind is that 80% of patients with COVID usually have a mild illness and often do not require oxygen. Yes, the body requires oxygen in general to function properly. And normally the oxygen saturation, that's what everybody is familiar with, which we measure in the blood, is about 96%, or the oxygen pressure, that's what some special labs measure, is normally around 100. So most people at home can measure saturation easily, and we all feel comfortable when the saturation is greater than 96. Sometimes it can drop to slightly lower levels, and it doesn't matter. We can still live with that. And if it drops to 95 or even lower, then the body can still cope. The body has got efficient coping mechanisms. And let me give you 2 examples of what happens when, when we're in our day-to-day lives, when oxygen drops and we are still okay with that. One example is air travel. And the second example, which very few people do, is climbing to Mount Everest. Now, what happens with air travel? Before we do that, the way we get, the air we breathe contains oxygen. And the air is normally at atmospheric pressure, which is about 760 millimeters of mercury. And therefore, the oxygen is in that air has got a pressure of about 150. So whenever the atmospheric pressure drops, the oxygen pressure will also drop. So it's well known that when we go to high altitudes, the atmospheric pressure drops, and therefore, consequently, the oxygen pressure will also drop. So let's see what happens when you go in an airplane. So this graph here, you can see, is the atmospheric pressure on the x-axis and the altitude on the y-axis. Now, people living in Kolkata or Chennai, they are obviously at sea level, and the pressure is about 760. As you go in an airplane and the cruising altitude of a Boeing is around 10,000 meters, you can see there the atmospheric pressure at that height is only 200 millimeters of mercury. Now, but the airlines know that we can't survive with such, because the oxygen pressure will be so low at that height. That's why they pressurize the aircraft, and they pressurize the aircraft to around 2,500 meter altitude, which gives you a pressure of 600. So at a pressure of, normally, as I told you before, the oxygen pressure in the blood is 100, but at a pressure of 600, atmospheric pressure, the oxygen pressure drops to about 600, pressure to about 60 to 70. So what I'm trying to say here, and people undertake long flight journeys, from India to the US is about 15 hours. Singapore to London is 14 hours. Sydney to Los Angeles is about 13 hours. We can survive for long distances at slightly lower oxygen. And the reason I'm giving this example is to just emphasize to you, yes, when you get COVID, yes, there is a worry whether your oxygen levels will drop, but there's no need to panic. We can survive with slightly lower levels of oxygen for some time till you get medical attention. The second example I want to give you is when people climb to Mount Everest, and again, people have measured oxygen levels on top of Mount Everest. And so here is at sea level, you see the oxygen saturation with the pressure at 100 and the saturation about 96. On top of Mount Everest at 8,400 meters, you can see there the oxygen level, the saturation drops to about 60%. So and people have gone there and survived and come down. So yes, oxygen is important, but there is no need to sort of rush and be on oxygen if you're diagnosed with COVID. Just wait till you get medical help. So the take-home message is that measuring oxygen level provides another measure of your lung function. If it is greater than 96, it gives you reassurance. But if it drops below 94, all it's telling you is that the lung infection is, maybe it's building up and you must go and seek medical help. Biswas, I'll stop you for a while, for a couple of minutes. If you have any questions on what I've said so far. Biswas, can you hear me?
Yes, Venkatesh, I had muted myself. Now I've unmuted. Can you hear me now?
Yes.
Yeah.
Now, do you have any questions on the first 3 or 4 false beliefs?
Yes, I just like to make a couple of comments, Venkatesh, that as far as technology you mentioned, which can pinpoint the exact source or the person of infection, is something that I didn't know, and I feel astonished that there can be technology to this effect. Really wonderful. So is it available all over the world or only in certain countries?
No, so it is available all over the world. So, but what it requires is what's called genomic tracing. So, for example, in Australia, every person who tests positive for COVID-19, the genome is sequenced. So they can tell and they can compare the genome of this person with all the other genomes which are there in a library. So they can then pinpoint and say, this person obviously picked up the genome infection from that person. So they do what's called the contact tracing. So they try and link up. And if they can't establish a direct contact between this person and the previous person, then they know there has to be some intermediate person somewhere who must have been the carrier of the virus to give it to this person. So they try and do extensive contact tracing. And that's been one of the success stories of the Australian control system. And in fact, it has been commended as the world's best contact tracing system and was written up as a report in the New England Journal of Medicine.
Wonderful. Wonderful. I am not too sure if that is possible with the population of our country. But if it could be done, yes, I'm sure it would be a lot more helpful. Thank you.
Look, it is a challenge, but the scientists from India are calling for genomic sequencing to be conducted at least on a certain percentage of the cases.
Great.
Okay.
You also mentioned, Venkatesh, that there have been more cases in this first 5 months of 2021 than in the entire 2020.
Correct.
That is again something that I wasn't aware of, and thank you for this information. So there is basically, it tells us that we should not become complacent about any graph or numbers coming down. We should stick to our basics of wearing masks and maintaining physical distancing.
Correct. Absolutely.
You very well explained the importance of wearing masks, and CDC has been issuing notices about this. And of late, they have brought out this thing that in the current second wave, they have found out that double masking is probably more protective than a single masking. Do you also agree with that?
Look, I mean, obviously, the more the barriers, the better it is. It's a balance between compliance with mask wearing, because 2 masks add more discomfort.
I know.
So yes, I mean, it's if people can manage that, it's great, but it's not easy.
Yeah. Okay. I have been following that in our center ever since, and most of our staff have been following that. So we wear a surgical mask underneath and a cloth mask over that. So the cloth mask, what it does is basically improves the fitting of the edges of the surgical mask. That is, I think, the main help that it does. It is probably a little more uncomfortable than wearing single mask, but we have gotten used to it.
Right.
You showed wonderful graphs about the second wave and the third wave, the second wave of India and 3 waves of USA.
Yeah.
There are two observations I had. One is US's graph also showed a fourth hump. So is that a fourth wave, or is just part of the third wave
Oh,
coming?
look, it's look. I mean, the definition of a wave is. I mean, there's no clear. It's hard to define what a wave is, but you just look at the patterns. And I mean, I just left it as three. I think it's generally agreed that there've been three waves in the US.
So the doubt and the question among the minds of many in our country is there going to be a third wave in our country?
It's very possible and very likely, unless we can reach mass vaccination levels or a herd immunity, which I'll comment on later on.
Okay, great. I really appreciated your simulation of the oxygen concentration in the atmosphere in a flight simulations setup and climbing mountains, because all of us have been on long haul flights at some point or the other, and we have all gone through low oxygen situations. Now, one question: what is the SpO2 level in a long flight that we have approximately?
It sits. I mean, there are some adaptations of the body, but it sits somewhere around 91 to 93.
Excellent. So, which means we have survived 91 to 93 over 15 to 16 hours of flights.
Yeah.
One small comment about this mountaineers on Mount Everest is
Yeah.
that people who go mountain climbing are obviously physically much fitter than probably an obese or a person with comorbidities,
Yeah.
which again points out to the importance of maintaining optimum body weight and doing physical exercise for maintaining fitness. It is of very high importance in protection from COVID, the serious illness from COVID.
Correct. Correct.
Right, Venkatesh, please carry on. I'm
Okay.
very, yeah.
Thank you. So we go to the next fault again in the context of once you get COVID. There's been concern amongst members of the public whether one should start dexamethasone immediately. So it's probably worth remembering what dexamethasone is. And so dexamethasone is a type of steroid. So people are familiar with the words prednisolone and cortisone creams and so on. They're all steroids. And what steroids do is that they generally reduce the inflammation in the body. Now, COVID-19 causes inflammation in the lungs, and that's why dexamethasone has been tried in COVID to reduce inflammation. So that is the sort of rationale. But if you test positive for COVID, should you start it immediately? Well, so this is probably the most useful report that we have on the role of dexamethasone in COVID. It was called the Recovery Study, which was reported from the UK, and they studied about 8,000 patients with COVID. Now, this is a graph there, and I'll explain this to you. And what you've got here is what is called the forest plot. And these are the squares that you see here is the risk of dying. So if this falls on this side, it means the risk of dying is less with dexamethasone. And if it's on this side, the risk of dying is not so good, is no different from usual care. So what they did was they took three groups of people with COVID. People with extreme end of COVID who are on life support in the intensive care unit. Then people with moderate COVID who are just on oxygen but not on ventilation. And people with mild COVID who are not receiving any oxygen either. So in people with extreme COVID on life support, clearly when you gave them dexamethasone, their survival was much better. In people who were just receiving oxygen, people with moderate COVID, again, when you gave them dexamethasone, their survival was much better. On the other hand, when people were with mild COVID who were not receiving any oxygen, as most people would be at home. Then if they took dexamethasone, it really did not make any difference to their survival. There was no benefit, but no. And so that's why the take home message is, in people with mild COVID, you do not need to start dexamethasone immediately. In fact, you must only be starting dexamethasone on the advice of a medical physician. So the question can be asked, is there any harm in taking dexamethasone? And again, once again, I want to reiterate the message that it is not, best is not to take it if it's not required. Always get medical advice before you take it. And in patients with diabetes, it can increase your blood sugar levels, and it can also change the salt levels in the blood. Your sodium levels can go up and your potassium levels can go down with dexamethasone. So that's why it needs to be on the advice of a medical physician. Now, the other drug where people were concerned was that we should be taking remdesivir as soon as COVID is diagnosed. It's another false belief. That's why I call it false belief, that remdesivir should be commenced as soon as COVID is diagnosed. Again, this was another report which came from the United States, and this is again published in the New England Journal of Medicine, which is the world's most prestigious journal. And basically what they showed was that all that remdesivir did was reduce the symptom duration. And again, it only was beneficial in hospitalized patients. So if you're at home with COVID, you do not need remdesivir. And also, it did not have the same survival benefit as dexamethasone. So there's really no rush to go and get remdesivir. And again, you should only be doing this with advice from a medical physician. So in the context of an antiviral agent, a number of other antiviral agents have been tested. What's called Tamiflu, which is for influenza. There's another agent called favipiravir, which has been looked at. And the lopinavir and ritonavir combination, it goes by the name of Kaletra, that's been looked at, and interferon. And none of these drugs have been shown to have any survival benefit with COVID. So the key message really is, do not start any of these medications, and they all have some side effects. So it's important that if you're going to start any of these medications, you have physician advice before you do that. And I just want to talk very briefly in the context of when all these drugs are available for use. And there have also been reports of herbal medicines and naturopathy and alternative medicines and so on. I think the most important question is not whether it's allopathic medicine or Ayurvedic or herbal. What's important is what is an effective medicine. Any of the above can be effective, but the only way we can establish this efficacy is through what we call clinical trials, and where you study large patient populations. For example, the Pfizer vaccine was studied in 45,000 members of the public. The AstraZeneca was studied in several thousands. The recovery study I showed you before about dexamethasone was studied in 8,000. And this morning, they've released a study of the Chinese vaccine in one of the premier journals, and they've studied about 43,000 members of the public. So it's only when you study in large numbers where you compare the active agent with the placebo, or what we call the dummy, that you can test the efficacy. And the other important aspect of all these drugs is when you go through large clinical trials, they are peer-reviewed, therefore they are assessed by an independent group in a journal who have no conflicts of interest, and so they are assessed independently, and then they are published. And once the efficacy is established through well-conducted clinical trials, then it becomes part of standard treatment, irrespective of whether it's allopathic or herbal. I think that's the key message. So once Once it then becomes incorporated into standard guidelines, and then the national bodies will release guidelines based on the most up-to-date evidence. So my advice to people is always seek the advice of a medical practitioner. There are lots of messages going around on social media about this and that, but always get advice from a medical practitioner, and that's the safest way of getting any commencing any treatment. So I'll stop there. Biswas, any questions on the last couple? Biswas, you're there?
Again, I forgot to unmute myself. Okay, now I'm on. Yeah. Okay.
No
Yeah,
problem.
I think you made a very important point about dexamethasone. You did mention that one should follow the prescription of a registered medical practitioner. Unfortunately, I don't know how it is in other countries, but I see a lot of prescriptions where dexamethasone has been prescribed in initial stage of COVID, which is probably harmful, and one should try to avoid it. Yes, that is one. Second thing, you did mention about vaccines. We all know about the efficacy of the various vaccines, and you very nicely put up the studies that have been done. Unfortunately, over the last few days, there have been some WhatsApp forwards going on all over the place, which is kind of public is getting confused because there's a lot of anti-propaganda against vaccines going on. I don't know whether it's going on in your country or not, but over here in India, the WhatsApp messages are full of them. In fact, one of our viewers called Anusha Ramji has put forward a question about this WhatsApp messages. Let me see. She has put a comment about, wow, I didn't realize there was actual research about misinformation. Any suggestion as to how we can tackle misinformation in India? WhatsApp is unfortunately considered a reliable source, to which my reply would be that WhatsApp forwards are probably not reliable source of information. Would you like to add on to that, Venkatesh?
Look, I think the more, yes. Look, there are a number of forwards. We're all members of WhatsApp groups. There are lots of forwards. I guess look, it's hard to know. Some are useful, but the majority that I get anyway, I just don't even read them because I don't believe they are accurate. But what I would recommend is if they want to find out information about on the internet about misinformation, information about misinformation, then the only way to do it is there are some reliable medical websites, and there are very high quality journals, and they can go, and it's available to members of the public. They can search those and they can get access to that.
Yes, I guess if anybody wants to check out anything, I think World Health Organization site is useful, as well as CDC sites, these two sites, and the Government of India site. All these three sites are reliable and useful. In fact, I was looking up World Health Organization site, and they have introduced this new terminology called infodemic.
Yeah.
That's the pandemic of misinformation about COVID-19 infection, which one must be very, very careful about. There have been other comments from Anusha Ramji. She has been listening very critically. Is COVID likely a lot worse than the numbers recorded? Because we don't necessarily have the resources to test so many people. What do you say to that?
So in the test, so one of the ways of looking at it is looking at the testing rates in different parts of the world. So the testing rate in India is sitting at about 240,000 per million population, whilst in the UK it's almost close to 4 million per million population, which means each person has been tested about 3 or 4 times. So, and it's all to do with the availability of resources and so on. And therefore, if you under test then there's a real risk that you might underestimate the number of infections. When people have done what's called serological surveys looking for COVID antibodies, and when they have done studies in villages in certain regions, the number of patients, number of tests coming back positive is about 25 to 40% of the tested cohort are coming back positive for COVID antibodies. This is before the vaccinations. So what I'm saying is, if you extrapolate that to the whole population in India, that means somewhere between 400 to 500 million people would have had COVID. We don't know. We don't know what the real number is, but it's an important point that she has raised.
One of the points I did mention to you about the misuse of steroids in early COVID infection has been pointed out by one Mr. Venkatakrishnan Natarajan, who has mentioned that in a comment box that people go onto steroid immediately as the oxygen drops to below 94. Is it right? That's his question.
So steroids must be started only by a medical practitioner. That's the first advice. And the second advice to give is the evidence has only been shown in people who are requiring supplemental oxygen.
Okay.
So if you do not require supplemental oxygen, so if you could go to a hospital, you're on 94%, but if the clinician feels that you do not require supplemental oxygen, then you're just there to be monitored. You do not need to be on steroids. Full stop.
Mm-hmm. Correct. There is a comment about mask wearing by Anusha Ramji about that CDC seems to say that it's okay to no longer wear a mask if you have been vaccinated. That's a bad idea because you can still get the virus and pass it on to others, right? May I take the liberty of initiating the answer, Dr. Venkatesh? Because I think what the CDC has said is only applicable to USA, and it is applicable in USA because all the USA citizens have been vaccinated. Am I right, Dr. Venkatesh?
Yeah, look up. Yes, I mean it's only applicable to the U.S. environment. I mean, I'm not sure that I won't say that all of them have been vaccinated, but certainly a large number have been vaccinated, or more than 50%. And also, it's possible to socially distance over there. Space is not an issue, and I think we've got to be careful about extrapolating their guidelines to our guidelines. So in India, where the caseloads are still very high, we should follow social distancing and mask wearing.
Dr. Raju Wilkinson, another listener, has posed a question in the comments box. What about inhaled steroids like Budecort?
Yeah. So inhaled steroids have, so there is some evidence from small studies in the UK that inhaled steroids reduced the duration of symptoms and reduced the severity of COVID. Now, the trial was published in the British Medical Journal. It had some limitations in terms of trial design, but I think the message is still very useful that yes, inhaled steroids could be used as part of a steroid inhaler. It's very similar to people with asthma using it. So you can use an inhaled steroid if you've got mild COVID, but not oral dexamethasone.
Great. There are a whole lot of comments and questions in the comment box. I would suggest that at the end of the talk, you can run through them or I'll help you go through them. We'll try to answer as many of them as is possible during the duration of this talk. Remaining, we can message them later on. In the meantime, about your last slide that you showed, which is still on, about the herbal or the naturopathy alternatives for treatment as well as increasing immunity. As you mentioned, they do not have any research-based evidence of those things. But in our country, India, majority of people drink a concoction of one of these spices or things, anything similar to that in the morning, hoping that it is going to improve the immunity. A lot of people in our country take vitamin C and multivitamins and zinc tablets, even if they do not have anything, just to increase immunity. And this is a vast topic in itself. just for the benefit of viewers, we have kept this topic for coming week, the next week, by a diet specialist, and we are going to talk about it. Venkatesh, I think our points have been cleared. Please carry on if I am not
Okay.
interrupting too much.
No, thank you. So the false belief number 7 is any eye problem is because of black fungus. Now, in the last few months, there have been reports of black fungus in several media outlets and newspapers in patients with COVID. That people are getting black fungus infections. Now, so the black fungus is caused by a fungus called mucor, and the first thing to reassure people is this is not a common infection that you would see in healthy adults. It is really seen in patients whose immunity is compromised, and also very frequently seen in people with diabetes. So I think it's yes, everybody is worried and anxious about all the reports, but the moment there are many reasons for eye discharge and eye symptoms, and not all of it is because of a black fungus infection. So that's just the key message to take home. Now, the next false belief is that vaccination for COVID is not effective and COVID vaccine is unsafe. Now, this is a problem because there are, as one of the comments from one of the viewers was about anti-vaccine messaging and in WhatsApp. Now, this is not just in India. This is happening in all over the world. There are a number of people who do not believe in vaccination, and I'll just show you here the evidence that COVID vaccine is effective. So this is the graph here, which shows the top 10 to 15 countries with the highest level of vaccination. Israel is right on top of the list there, followed by the UK, and US has done very well. So, I mean, these are really the top 3 to 5 countries. Now, if you look at the daily new cases in the United States, vaccination started in the US around the 10th of December, where you can see the arrow there. That's when the vaccination started. And obviously, I told you that Biden also introduced the mask wearing, but you see the trend and the effect of that, and the cases are going down steadily. Now, let's look at the UK. In the UK, the vaccination started before the peak of the third wave, again around mid to late December. And look at the effect on the number of cases. It's almost down to less than 2,000 to 3,000 cases a day. Let's look at another country, Israel, which was one of the best vaccinators in the world at the moment. Again, they had a third wave there, and they also started in mid-December when the third wave was still going up, and you can see there right after that, and the cases are now almost zero. So there is no question. There's no question that vaccination is effective and for COVID. And there are different vaccines around, but wherever people have had vaccinations, not only the case numbers come down, but you're also protected from the severity of COVID. So you could still have a COVID infection, but the infection is usually mild as compared to the unvaccinated patients. Now, the concern, of course, the other concern that people have is side effects of vaccines. So the general rules, not all vaccines have side effects. All drugs have some side effects. So the question really is, what is the risk of the side effect versus what's the risk of dying from COVID? And that's the key question. And so if you look at the Pfizer vaccine, one of the most significant side effects is an acute allergic reaction, what we call anaphylaxis. It's a life-threatening form of allergy, but that's only in patients who have had previous life-threatening allergic reactions. If you don't have a history of severe allergic reactions, then you can get a Pfizer vaccine and you will have no problems with the Pfizer vaccine. With the AstraZeneca vaccine and the Johnson & Johnson vaccine, there's been a report of risk of clots. Now, the risk of clots is about 1 in 100,000. And interestingly, we have in Australia, we've got the AstraZeneca vaccine. We've had some reports of clots, and that has seriously impacted on the patients or the public wanting to go and get the vaccine. Because in Australia, the situation is this: we have got zero COVID. We've got no COVID in the community, apart from 10 cases which have cropped up today, but we've got no COVID in the community. So people are asking the question, why should I expose myself to a vaccine when there is no COVID in the community? In countries like India, where COVID is rampant and so on, the benefits of the vaccine far outweigh the risks. So I would urge all people, if you have access to a vaccine, get vaccinated. The other belief that people have is that herd immunity will protect us if you let the virus run through the community. Why should I get vaccinated? So herd immunity is over a course of time, you have infections from one to the other, and we all develop natural immunity. And for that to happen, about 70 to 80% of the population have to get infected. Now, I'll show you the consequences of such an approach. And this is 4 countries in Scandinavia. I showed these 4 countries because all these countries belong to the same geographic region, same latitude, same climate, similar food habits, similar socio-economic standards, similar healthcare systems. And 3 of the 4 countries followed social distancing, mask wearing, which is Denmark, Norway, and Finland. On the other hand, Sweden believed in herd immunity, and they let people go around. And so you can see there the number of COVID cases they've had per million population in Sweden as compared to the other 3 countries, and consequently the number of deaths that they've had per million population. So there is no question, if you use the herd immunity approach, you'll have more infections and you will have more deaths. And so if we can avoid that, as most countries have chosen to, then that's the best way. And of course, the other way of getting herd immunity is to get vaccinated. If a large section of the community gets vaccinated, then you will get herd immunity. So herd immunity is, we must not be letting the virus run through the community. And my last false belief that I want to put out there is this, particularly focusing on the younger people, because there are a number of younger people who believe that I'm young and fit, I won't get COVID. So here is the table from international data where they've looked at the risk of getting COVID and the risk of getting hospitalized from that and the risk of death from COVID. So what they've got here is age right on top there. The row heading is age, and they've got columns by 10-yearly epochs. And so they've taken the 5 to 17-year age group as the reference group, so as compared to a 5 to 17-year-old person, someone between the age of 18 to 40 has 2-fold risk of catching COVID, a 6 to 10 times higher chance of hospitalization, and a 10 to 40 times chances of dying. So the message is that younger people, yes, as compared to someone in their 60s to 80s, yes, your risk is less, but the risk is not zero. So please follow social distancing, mask wearing, and please get vaccinated at the earliest possible opportunity. So to conclude, my take-home message to all people is that the COVID-19 pandemic is still active. It's rampant and will be there for the next 12 to 18 months at least, if not longer. Please take precautions. Please practice mask usage and follow social distancing. Get vaccinated at the earliest possible opportunity. If you test positive for COVID-19, you will naturally be worried, but most of the time the infections are mild and all you need is paracetamol for fever and hydrate yourself well. Keep an eye on your temperature and oxygen saturation. If the saturation stays persistently below 94, or if you're starting to feel short of breath, then you seek medical advice. And do not start any medications of your own, and the majority of cases do not require hospitalization, and it gets better over a few days. So thank you all, and I'm happy to take questions, and I'd like to wish you all the very best. Thank you, Biswas.
Thanks, Venkatesh. That was a very comprehensive discussion about COVID-19 infection, its present status, and prevention and management, as applicable or as the patients or the general public should know. Now, there are a few questions in the comments box. I'm going to deal with them one by one. There is a question by Ashok Manju. The question is there any study about how long the person who has taken the vaccine have immunity? Will a booster dose be required?
So the best evidence we have is for the Pfizer vaccine to date, where they've demonstrated benefits for at least 6 months. But the most likely, I guess the feeling is that most of us will require a booster dose. It'd be like the flu vaccine. We'll probably all have to take an yearly booster.
Okay. There is a question by a viewer by the name of Nikita Rohatki. She has written, "Sir, are there some particular blood groups more susceptible to COVID-19? Is this a myth?"
Well, look, there have been some reports of certain groups being more likely to be impacted by COVID-19. The reality is that is not a risk factor that we can change. So if you're born with a particular blood group, it is the way it is. And so there is nothing we can do to change that. So yes, look, the treatment is still the same. And again, the evidence to link it to a blood group is really not that strong. There's really, based on some genomic studies, they've shown that, but it's not very strong. I would advise the members of the public not to worry about your blood group. That really should not impact on all the precautions and the steps that you should be taking.
And there's a comment by Mr. Gautam Mitra, and this comment refers to an average prescription in India from a doctor, physician, anywhere in the country, which will always include drugs such as ivermectin, doxycycline, and even dexamethasone in many cases of early COVID infection. So what are your views on drugs such as ivermectin or doxycycline and things like that?
So there have been some reports on ivermectin, and doxycycline has been studied in detail in a number of trials, and there's no evidence of benefit for doxycycline. There is really no evidence of benefit for ivermectin either. So ivermectin has not been studied in any large-scale trial so far. So it should not be prescribed routinely, and I would not advise anyone to take it because there's no evidence to support it.
Yeah, I would like to add on to that comment that I am an ophthalmologist by profession, but being a doctor, I do receive phone calls from friends and relatives about people who have got COVID-19 infection or have an infection of someone at home. And thus far, I have managed all of them by a daily monitoring with only paracetamol and nothing else, because mild COVID infections don't need anything else. They wear off in about a few days' time. Venkatesh, I'm so sure you will agree with that. That's exactly what you had mentioned in your presentation also.
Yeah.
Yeah. There is a comment by Mr. Venkatakrishnan Natarajan that what is the link between CT scan reading on a base of 25, D-dimer reading, and oxygen level of 94% or below? The question is in the context of steroids.
Yeah. So I think there have been a push to doing CT scans on a regular basis in patients with COVID-19. I think the most important message is the best evidence for steroids comes from the recovery trial, and and that's for patients with mild COVID, not for not for severe COVID. So for mild COVID, that's the only trial which has looked at it in detail. And what I would say is there is really no indication to be starting dexamethasone based on um, based on a particular blood result or particular X-ray report or a CT scan report. The most important determinant is the life-threatening nature of the illness. So if you've got severe COVID, steroids help you. If you're requiring oxygen, steroids help you.
Okay. Venkatesh, can you just click on the comments icon to the right of the screen?
So should I stop sharing now?
No. Yeah, you can stop sharing. You can stop sharing and go to the comments icon on the right-hand side and click on that, because there's one comment which I'm not able to comprehend the meaning of that.
Where's the comments icon?
Because the comments icon is on the right-hand side upper portion.
Yeah.
You have,
yes.
If you click on that, you get all the comments, and you can scroll over the comments. There are plenty of them. There was a comment at 4:30. They are arranged according to the time. There was a comment at 4:35 p.m. by Anusha Ramji. Can you read that and try to answer that?
4:35 p.m. What is the?
When it comes to efficacy, it starts with that. When it comes to efficacy.
Yeah. So the question really is, the question she is asking is, so efficacy is when you do the study in very ideal circumstances, and effectiveness is when you're doing it in the real world setting. The point is that, will a study which is done in the US, will it be applicable, the results applicable to India? And the answer is, biologically, the body is not very different from what happens from the American population to the Indian cohort. I mean, yes, of course, there are, people that are different build and there are some differences in genetics, but the fundamental body functions are all very similar. So it's not possible to repeat a trial, every single study in every part of the world. We can't do it. So all you can do is do a large study. And when you do a large study, generally you will enroll people from different backgrounds into the trial. And therefore, when you do the analyses, the result that you see will reflect the effect of having different populations in the study. So that's the only way you can do it. And but that said, the Solidarity trial was conducted in about 108 countries, which is again, and India took part of the Solidarity trial for COVID-19. Yes, so I think that's the answer to that question. It's not if a study, the UK study will apply to India, I have no reason to believe it won't apply to the Indian population.
Great. We are nearing the end of this discussion. I'd just like to mention that there is a viewer, Moitri Mondol. She has congratulated both you and me for this presentation. There is another comment by Anusha Ramji just now about sample sizes. Are you able to see the comment right at the bottom at 5:03 p.m.? It could be a different time on your monitor, on your laptop.
Mine is
yeah. I know.
Hold on. Just
the second last comment in the comments box. Basically, her question refers to that aren't all vaccines effective? That is what she wants a reassurance about.
Are all vaccines effective?
Yes.
The data we have on all the published vaccines, they're all effective. There's no question.
Yes.
So what vaccines there? Yes.
You did mention. I think is there anything more to add? If not, then I'd like to probably end with a small WhatsApp joke that is going around nowadays. This about side effects. You see, as doctors in this country, we face a lot of questions from patients whenever we write out a prescription. The doctor, is there a side effect of this drug? Is there a side effect of that drug? And now people are pretty scared about side effects of vaccines. We all know that every medicine, every injection will have some side effect of the other. We know that the side effects are rare, very rare. I mean, there is much more side effects to the lifestyle that patients or people follow, like their eating lifestyle, the things they eat, the roadside food, the restaurants, the unmonitored hygiene, the smoking, and the alcohol, and they are never bothered about the side effects of those things. They are never bothered about the side effects of obesity and putting on weight, but they are very bothered about the side effects of medicine prescribed by a doctor, right? That's a joke.
Correct. Indeed.
I know.
Indeed.
Right, Venkatesh, that was an enjoyable session.
Oh, thank you. And firstly, again, I want to thank you for your great service to the public. I mean, it is your dedication, your commitment to do this on a weekly basis is fantastic. And I think we're all enriched by this experience. I think the viewers, the speakers, the participants, not just enriched, but also humbled by how much you do. And and I think for members of the public who do not know, Biswas and I, we were both in medical school together in Vellore. And I mean, he's one of the well-renowned ophthalmologists in Calcutta, but he does a monthly, he travels overnight when he was able to, not during COVID, of course, but when he was able to, he was traveling every month to offer a service to people in the leprosy clinic, which was run by two other friends of my classmates of mine in Naini in Uttar Pradesh. And Biswas did that, and he runs a school camp for free eye checkups for his school. And I think it's tremendous service, and we salute you for doing that.
Thank you very much, Venkatesh. All you guys are my inspiration, and you guys are doing much more than what I am doing. Thank you very much. It's all a blessing and a privilege for me to be able to do what I am doing.
Thank you.
Thank you.
All the best. Good night.
We'll put an end to this show. We'll meet again, Venkatesh. Bye-bye. Good night.
Bye-bye.